Hi, my name is April Showalter and I'm the Physician Assistant at Allergy Asthma Associates. Today I would like to talk about a pulmonary test called exhaled nitric oxide. If you were to come into our clinic coughing, wheezing, shortness of breath, or have asthma already diagnosed, this is a test that we would do to monitor your airway inflammation. Today we're going to have Allie actually show us how to use the exhaled nitric oxide machine. Thank you, Allie. So hold the mouthpiece there. Are you ready?
Yes.
Okay. Put the mouthpiece in and slow deep breath in. And when you're ready, nice gentle blow. A little more, right there. Sustain that. Keep blowing, keep blowing. Keep blowing, a little more, almost there. And we're done. Thank you, Allie. So this is an easy test that we can do to monitor airway inflammation, which is common with asthma. If you have any questions about this test or think that you might have asthma yourself, please visit our website or call us for a consultation. Thank you.